Tripler Army Medical Center, and it was the first facility in the country that would see men. But at the end of the day, the question is really about what do we do to stop violence in the home? And I know that there are behavioral health issues, but I cannot help but believe at the end of the day, this is education. This is all of us together, men and women.
Ms. Lujan Grisham.
You know, the first effort that you can take as a congresswoman is to really make sure that the House passes the Violence Against Women Act. I mean, it's been stalled for far too long, and it is, for the first time, the Senate version better, and the House version needs the same protections. For the first time, it provides protections in Indian country so that we can prosecute those perpetrators, and we're not able to do that. So it equalizes the protections for Native women, and that is so important here. Domestic violence, that issue has a lot to do with poverty. The more that we do to reinvest in middle class and to make sure that this is a government that's on your side and not on your back, as to creating those socio-economic supports, the more that we can do address domestic violence. But the immediate start for your Congresswoman is to make sure that the Violence Against Women's Act is passed. And I will do that.
Okay, and this will be our last question before we go to the candidates exchanging questions. And we'll start with Ms. Lujan Grisham. What do you see as the federal government's role in assuring health care to all Americans?
I think the federal government has a significant role, which is why I support the Affordable Care Act. You know, I gave my personal story where my father, a dentist, worked hard his whole life, but he had no protections. 20 years, and my sister had a brain tumor. I was meeting with teachers yesterday, and I think the sense is, and the notion is, that all public employees get that fabulous health care benefit and they don't have to worry. Well, as a teacher, her out-of-pocket costs between her co-pays and deductibles, she needs another surgery, and she's not going to get it because her out-of-pocket costs are going to be $3,000, and she doesn't have it. This country has to take a responsive and responsibility in effort to create a level playing field so that we can exercise our healthcare choices. But when you're denied coverage, when you have no control over those costs, where your tax dollars into Medicare and Medicaid provide you no protections in those benefits, where Medicaid is completely controlled by the states in terms of eligibility and benefits, who waits, who doesn't, who's covered. We have 21,000 children waiting in this state. There has to be a set of policies that assure that those who are currently paying into the system are not the only ones, because it's bankrupting us. 17% of gross domestic product is not sustainable. We're the only industrialized nation in the world who hasn't set a federal agenda to solve the problem.
Ms. Arnold-Jones.
There's an appropriate role for the federal government in health care. Call it a safety net. I think that's a good word to start with. But what we have done with the Affordable Care Act, in my opinion, actually shifts the burden where I would like the federal government to actually exercise its role. What it did was to hand it off to the insurance companies, actually complicating the issue and literally siphoning probably a third of our resources out of healthcare into administration. That isn't what I have in mind. So what we can do, I believe we need to get back to the table and look at these things, because I don't want there to be a middleman. I don't want things like insurance to impede our access to health care. But clearly, there is a role for the federal government.
Now we've reached the time when the candidates will ask a question of each other, and we will begin with Ms. Arnold-Jones asking her question of Ms. Lujan Grisham.
So Michelle, could you tell us how the Affordable Care Act will help your company to easily create jobs in the private sector?
Well, my company is responsible, I should say thank you, Janice. My company is a consulting company, and in a competitive bid was able to get a contract from the state of New Mexico in this administration to run the federal high-risk pool. Federal high-risk pool covers people with a pre-existing condition who have had no insurance for 6 months. It's one of the most successful high-risk pools in the country, and it created a couple more jobs in my company. But more importantly, it brought $100 million into the state of New Mexico to provide health care coverage for people who really needed it. People like my family, who without that program wouldn't have had it. But I will tell you that the economic stimulus of the more than 200, probably closer to 240 million today, and the billions of dollars that are going to come into the state, I think that economic stimulus and the amount of money that will go into the state and the premium taxes that will go into the state coffers will provide New Mexico numerous opportunities for prosperity and wealth, and for making sure that we create the high-tech jobs of the future, including in the healthcare delivery system.
Next, Ms. Lujan Grisham will ask her question of Ms. Arnold-Jones.
Thank you. Janice, tonight you've been very effective at talking about the importance of Medicare, the value of Medicaid, and the role of government in healthcare. But you support the Ryan budget, which turns Medicare into a voucher program. It's voucher care, and block grants Medicaid would harm the exact folks that you said you were advocating for on the disability waiver. I don't know where you stand on healthcare. Where do you really stand, and what is your plan?
Michelle, thanks for that question.
Hard questions.
I really do stand with certain parts of the Ryan plan. I like the Ryan plan because it guarantees that Medicare and Social Security in particular is safeguarded. If you are over 55, you are safeguarded. I like that part. Am I concerned about Medicaid, and especially the very fragile community served by DD waivers? I am, and I make no bones about it. I am going to go and search for answers, because I look around and I don't see really adequate answers. But in Congress, that is what you are supposed to do. You are supposed to pull every resource available to come up with the best answer. So your question was, where do I really stand on health care? My Lord, we need it, but we need to find a way to make sure we are delivering it without bankrupting our nation and giving individuals the most choice in their lives.
For closing remarks, we're going to begin with Ms. Arnold-Jones.
Well, I think this has been a terrific discussion, and I am so grateful that the venue was provided. Thank you so much. I must say, Michelle, I hope that this discussion will go on. You know, healthcare is a real concern to voters. Truly it is. But the biggest issue to voters in this district is jobs. In fact, not only are they concerned, they are despairing. So, Michelle, I'm going to issue an invitation one more time. I hope you will take the invitation of the Albuquerque Chamber of Commerce to come and talk about jobs. I think in the first district, you all need to and deserve to hear what we think. I truly hope that you will reconsider that invitation. This is a time that you need strong leadership. You know, being a member of a legislative body means understanding what the bills are, making sure that you have context, and it's not just from the government's perspective. I am well prepared to represent you, having been a small business owner as well as a legislator, being a mom and a Navy wife. I am prepared to represent you in Washington. It would be my honor to do so. Thank you so much for having us this evening.
Ms. Lujan.